Hey everyone, my name is Emaan Chaudry.
And my name is Danielle Solish, and today you're listening to the 11th episode of Seeing Clearly, a pre-clerkship guide to all things ophthalmology. On today's episode, we will be interviewing Dr. Garfield Miller.
Dr. Miller is an ophthalmologist and assistant professor at the University of Ottawa Eye Institute. He has been practicing at the Ottawa Hospital since 2011. Dr. Miller obtained a bachelor's degree in science at McMaster University and later completed medical school and residency at the University of Toronto. During his 5-year residency, he developed a passion for patients suffering from glaucoma and was accepted into the Glaucoma and Advanced Anterior Segment Surgery Fellowship at the University of Toronto, specializing in complex cataracts and micro-invasive techniques.
At the University of Ottawa Eye Institute, Dr. Miller is a full-time academic staff and assistant professor. He's involved in teaching and research. He specializes specifically in cataracts, anterior segment repair, and complex glaucoma management. Dr. Miller also coordinates the glaucoma curriculum and has an interest in neuroprotection. So without further ado, we would love to introduce Dr. Miller.
Thank you very much for the very kind introduction. This is my first podcast, so please go easy on me.
Well, thank you for being with us today. So I guess we'll just jump right into it. And we ask most of our guests this question at the beginning of the episode, but do you mind just talking to us about what drew you to the field of ophthalmology?
You know what? It's interesting. It's really, I feel almost like, ophthalmology sort of called me in. It's a really weird thing. Back when I was actually in high school, I was doing this program during the summers at the University of Toronto, and was just sort of hanging around there. And this actually was this program called the Summer Mentorship Program. This is way back, and had a chance to get a little bit of exposure to medicine through that, and had a lot of fun with the people there. And after, I think it was after it finished, I decided, I was just sitting around at home, typical summer as a teenager, and said, I might as well do some volunteer work. So I asked them, I said, is there anyone who needs some help just doing some volunteer hours? And they connected me with the eye bank of Ontario over, and it was at that time, it was at 1 Spadina Crescent in Toronto. And they needed help just like cleaning up their storage room, and they were going to sort of an electronic system, so data entry and so on. So I was just doing, just that type of stuff, like literally cleaning out boxes and stuff. But I worked hard at it, and eventually they were particularly short staffed, so they got me answering phones, and then next thing you know, I was checking blood work, and next thing you know, I was calling donor families. And after that, I started processing eyes. So for those who don't know, at the eye bank, basically eyes that are donated from people who've passed away are sent to the eye bank, and then they're processed. And then corneas or donor sclera are processed and sent for surgery for patients who need it. So so I became a technician there at the eye bank, and they told me I was the youngest technician ever there, but mainly because they were just really short staffed and people needed their summer holidays. So that sort of became my my summer job for a few years. And even after I started university, I went back and did some work there and did a little bit of research there. So that was, even then, that wasn't really the plan to do ophthalmology. I wasn't even, sure if I would be in medicine or anything at that point. But then later on, my father, who was in public health for years, and that was his career, ended up doing some work with CBMI, which is Christian Blind Mission International, which is the biggest NGO that does vision work in the world. And he became the overseas manager. And then through him, I ended up meeting a bunch of ophthalmologists who do a lot of overseas work, and was inspired by that. But even then, I wasn't convinced I was going to be doing ophthalmology. It's just another random occurrence. And then finally, a friend of mine who was a year or two ahead of me, who lived in the same residence that I did when I was at U of T doing medical school, he was really interested in ophthalmology, and he kept telling me that I need to try this out. I need to get into it. And then finally, I did an elective, and then that was that sort of cinched it once I finally actually got in and got my hands dirty. So yeah, it was sort of a bunch of occurrences going back from high school that they all drew me in.
No, that's awesome. Because I find that a lot of our guests kind of didn't find it until clerkship of their electives, and then they randomly stumble upon it. But it feels like it kind of came to you, and especially getting the exposure at such a young age, that's incredible. So thank you for sharing that with us. And so now, just switching gears in terms of kind of what you do right now, could you talk a little bit about what it's like in the life of a glaucoma specialist?
You know, as a glaucoma specialist, you are, actually, just to go back a bit, the issue with glaucoma is that it's a chronic disease. It's, I often, when I'm first seeing patients, I sort of give them the breakdown. I talk a little bit about anatomy. I give them a couple analogies and so on. And the deal is that the optic nerve, it's part of the central nervous system. A lot of times people think central nervous system, brain, spinal cord, but they forget that the optic nerve is actually part of the central nervous system. That means that the tissue you have in your optic nerve, whatever you're born with, that's all you got for life. And the problem is that with glaucoma, you burn through your reserve, and then any bit that you lose, after that, you start losing visual function, and you will never improve it. And so that's a hard thing. So glaucoma, it becomes a field and a specialty where sometimes you can feel like you're never winning. It's sort of like, in a way, you're just trying to keep things stable or slow down the loss. So with as much as there's a lot of development and cool surgeries, and glaucoma has become something that's really flashy and so on, there is that reality that it's really important to really deal with patients on a very personal level, help them understand their disease, help them to really take ownership of their disease process, and recognize that it's a lifelong deal. So there's no quick fixes, and really separate it from the idea that a lot of people have regarding cataract surgery and those sort of things, and say, this is something totally different. And even though we have surgery for it, the surgery is just to control. This isn't to fix anything. So when you talk about, a day in the life of a glaucoma specialist or glaucoma surgeon, and once you're doing, every ophthalmologist has to deal with glaucoma because it's just so unbelievably common. So when you're a glaucoma subspecialist, you're dealing with the worst of the worst cases, which means a lot of people who are blind, going blind, or partially blind. And so I find that you have to really enjoy and appreciate being able to walk with people through hardship and understanding, and being able to have tough conversations, and recognizing that a lot of what you get out of it is knowing that you have helped to preserve someone's vision. I was joking around with someone that I don't get a lot of Christmas gifts, from my patients, in the sense that, they're if I'm doing cataracts, yeah, they'll give me a Christmas gift because I gave them their vision back. But for a glaucoma patient, I've just done the most intricate surgery. I'm proud of myself. I'm like, man, we just saved this person's vision, and they're like, doctor, my vision's not better, And so it's a totally different frame of mind. But it's, at the end of the day, it comes down to, where do you get your joy? Where do you get your satisfaction from? And I think, even though there's lots of cool surgeries, so I'll do, a lot of micro-invasive or surgeries for patients. I'll do special lasers, which are a lot of fun to do. You're combining complex cataracts with glaucoma procedures, and trabeculectomies and tubes and weird things like that. And then you have your clinic, you have your minor procedures, lots of varied things and so on. But intermixed in all of that is really that journey with the patient. And I think that takes up a lot of your energy and your time. And it's just a matter of having the right appreciation for that, and being able to take joy and satisfaction out of knowing that you have helped people along through that process, even if it's a process where there isn't really a quote unquote happy ending from the standpoint of giving someone their vision back, but knowing that you've helped them through to at least understand and appreciate what's going on, so that they can they can sort of deal with it better.
Well, thank you for sharing all of that. I mean, like you said, whether or not, I guess, the patient knows how much you've helped or not, I mean, it's amazing to see how you kind of push through, whether it's positive or negative feedback from the patients, knowing that you've done the most that you can do. So it's really incredible to hear that. Um, so many subspecialties of ophthalmology, I guess there's a lot of work to be done internationally. And for those of you who don't know, Dr. Miller has had some opportunities to teach nationally as well as internationally. So do you mind talking about some of those opportunities that you've had being a glaucoma specialist or just an ophthalmologist in general?
I am so grateful for, I've had a lot of opportunities from the standpoint of great mentors in the past. And, I think, I always think about that because I've done a lot of mentoring in the past for people from, it's just been something I've done since, being probably in grade school, just mentoring other people, but I've also been mentored a lot. And, I think about my fellowship, which was just incredible. And it was with Ike Ahmed. He's just an incredible person and surgeon in Toronto and an international superstar when it comes to glaucoma and advanced cataract procedures and so on. And I had, doing a fellowship there, he would really make the effort to get us going from the standpoint of opportunities with teaching, with training, and being able to transfer the experiences that we had to other people. So from the time of even when I was doing my training during fellowship, I don't know how many meetings all over the US, Canada, and Mexico went and helped to train in from the standpoint of labs and so on at these various meetings, and just continued with that afterwards. So it's it's a lot of fun, being done training in various conferences and so on in the US, just with various wet labs and so on, teaching some micro-invasive techniques such as eye stent and endocyclophotocoagulation and various things like that. And then I've done some of the same things here in Canada. One of the amazing opportunity that I had was actually as a resident in my last year of residency. I had the opportunity to go to Swaziland, and that was incredible, and had a chance to work with Dr. Jonathan Pons, who's at that time, he was the only ophthalmologist in Swaziland, and he would go all over the country, and he had his own little private plane, and he was a pilot as well, and he'd fly places and go and give care and do all sorts of amazing things. And he'd have people come every once in a while, and he would train and teach people a lot of his techniques, because he had a very unique practice where he did a small incision cataract surgery, and then he would also, because in Swaziland they have a very high rate of HIV and tuberculosis, he would also see a ton of pathology that we just don't see regularly other places. So for me, it was great. I learned a ton there, but also had an opportunity to talk to him about a lot of the procedures and so on that we were doing here in Canada, and that I was learning here in residency when I was in Toronto. And so there was a lot of shared ideas and shared techniques, and we were sort of going back and forth. And it was really just a unique and amazing opportunity to see the culture, to see the completely different pathology, different working conditions, learning how to be resourceful, learning a new way of doing cataract surgery. And it was just a phenomenal experience. So I've certainly had my fair share of great experiences and both nationally, internationally, and so on. And hopefully I'll be able to do a lot more.
That's incredible. It's also just incredible to see that there's such like a big community within ophthalmology that, and we've heard this from so many of our guests on the podcast, that there's always someone willing to teach them something new, and there's always so much to learn. And wherever you are, there are so many different pathologies that you are going to see. So getting those opportunities, even working within a different center, you learn so much. So that's great. Thank you for sharing. And I guess that brings us to our last kind of academic ophthalmology focused question, which is if you could share any advice for our student learners, our student listeners, like what would that be, especially those who are interested in pursuing ophthalmology?
I think, and you probably hear this from a lot of people, it's a very small community, it's small community. It's, the ophthalmology department within hospitals is always tiny, so I think it's just important to be a good person, to be someone who, is going to get things done without someone looking over your shoulder. You have to be motivated. You have to care for people, that you'll, I know it's being said, and I know they've done surveys and stuff of this, and that people, when it comes to people and what they're most fearful of losing from the standpoint of, a limb or something with their health and so on, other than their mental faculties, it's basically their vision that people care about, are most fearful of losing. So it's really a specialty where you really do have to care and appreciate the just how precious vision is. So I would say that for it's important for people to maintain that that focus, that humanity, and also for people to maintain that drive, and that there has to be that inner desire. It's not even something that can really be taught, I would say. There has to be that inner desire to be a good person, be someone who gets things done without having to be asked, and then also be someone who really cares. You have to have people who care, and so I think that when, in general, you'll hear people say that ophthalmologists are usually just good people, they're really nice people, and so on. And I think the specialty really selects for that. Because yes, you got to have a little bit of OCD, and you got to be a little bit, they're, a lot of my colleagues, they're pretty smart people and everything, but you know what, they're also really nice, they're good people. Like, we hang out, like I have a lot of, friends here, and we hang out and do things together and so on, and they're good people. So I think that those are sort of things that that we look out for, and I think it's great when it's a nice community to be a part of. I'll put it that way. So it's I think that it draws those type of people in.
It's so nice to hear you say that. And I feel like we get similar answers from a lot of our guests, that, the ophthalmology community is just made up of a lot of really kind, nice individuals. But I think I really enjoyed how you said that it's so important to appreciate how important someone's vision is to themselves. Because if you think about that, and you think about how important what you're treating is in terms of your patient, it kind of guides how you'll interact with them and how you'll act. And so I think that that's really great and really valuable from a student perspective, to always think back to the basics and think back to what's most important. And what's most important is knowing what's important to your patient. So thank you for that. And so with that, I guess that's the end of our ophthalmology related questions. And we'll transition into a more fun part of our episode, which is the Would You Rather segment. So I'll just get started with the first question here, which is, would you rather eat all of your food cold or all of your food hot?
Oh my goodness, hot food, without a doubt. My family is from Jamaica, and it is the hot meal is critical. And I remember when I was little, my parents would try to send a cold sandwich to school with me. It'd always come back. I needed something hot in the thermos. I didn't care what it was. It could be from dinner from yesterday. Hot food, without a doubt.
No, I feel like I would probably do the same thing. There's an occasional day where I'm okay with like a cold slice of pizza, but a hot meal is very different. And then our last would you rather question is, would you rather get one free round international plane ticket or be able to fly domestic anytime for free?
International. Yes, definitely. Yeah, I think that for me, and it's more, I think it's more about the time. I wish I had more time to do international travel. I love people. I really do. I just love interacting with people. I love relationships. I love humanity. I was in the biopsych program at McMaster, and I just love human interactions. I love the way people think. I love I love seeing the differences in people, but what I love more is seeing how similar we are, no matter, what race, religion, if it's gender, if it's anything, it's just people are people, and there's something amazing about that. So I just love interacting with people who are at first seem very different from me, and then just appreciating the similarities. And so I would love to do a lot more international travel. So get me that plane ticket. That's me for sure, 100%.
I think with that answer, most people would pick the international plane ticket. But with that, I just want to say thank you for being a part of this episode. We both really enjoyed chatting with you today, and really appreciate all of the honesty and advice that you've provided to us as well as our listeners. And so to our listeners, thank you so much for listening to this episode of Seeing Clearly, which is our pre-clerkship guide to all things ophthalmology. To stay caught up with everything else iCurriculum is doing, be sure to check out our website at www.icurriculum.com and to follow us on Instagram at iCurriculum. Thank you again, Dr. Miller, for being with us today, and hope everyone enjoyed the episode.
Thank you. Bye.